How's it going, everyone? I'm Dr. Vear at Binger Chiropractic, and today we're with one of our longtime patients, Barbara. Barbara's got some hip and knee pain, so we're going to treat that, but she also wants a wellness adjustment on her neck, mid-back, and low back, so I'll show you what that looks like. All right, Barb, go ahead and go face down for me. So, we're going to start off with a little bit of hypervolt, which is going to help move and kind of mobilize the tissue. We'll use the massage gun in cases like this when the joints are very stiff or the muscles are really tight. So we can just kind of help mobilize out the tissue. And we'll do this for about a minute or two, just to soften up the back muscles and lower back muscles. And just kind of sweep up and down the spine to get vibration into those tissues. And work on primarily, we'll find spots that are tighter. Like right now I found a spot that's pretty tight, right Barb?
Yes.
So we'll work on these tight muscles with the hypervolt, just kind of help get them loose. Makes the adjustment go a little bit easier, and it feels pretty nice to kind of get the massage gun into those tight tissues. Good, okay. So after that, with Barb, I do mostly a mobilization adjustment, which is basically kind of scanning the lower, or the mid and lower back. And once I find a spot, it's not a huge thrust, it's just kind of mobility work, like right there. And so you don't hear those huge pops, but it helps a lot with a lot tighter joints, as well as if the body's not ready for that quick thrust adjustment, like so. Same thing on the left. And just kind of rock into the tissue, see if you can get a little bit of mobility into the ribs. Good. After that, I like to use an activator. So the activator is good for joints that don't move particularly well, or patients that are older, they're in car accidents, that way you're not twisting or manipulating the neck too rough. So use this on different parts of the neck, like so. I'll find a spot right here and down there. Same thing on the other side. Okay, easy peasy. All right, Barb, go ahead and go on your back. And now we're gonna do the hip and knee adjustment. And it's always Barb, left hip, correct?
Right hip.
Right hip. Yeah, right. It's always the right hip that's bothering her. So hip adjustment, we want to see how it moves, which...
It's my knee doesn't move.
Yeah, gotcha, okay. So in order to get some mobility, we do what's called a long axis distraction. And that kind of moves both the hip and the knee at the same time. Like that.
Okay.
And it's a little bit jolting, but it works really well to help separate out the compression of that hip and knee joint. Alrighty, and that's it for Barb. Come on up. Alright, so if you liked that video, make sure you like and subscribe, and we'll catch you on the next video.